Unfortunately, it's very, very cheap to buy fentanyl. So the pills on the street in Snohomish County are selling for about $2 a pill right now.
$2 a pill.
I have clients that smoke 60 to 70 of them a day.
Hi, Mark.
Hi, Mark.
Mark. Hey, Mark Hallie.
The Mark Hallie Show. How did you do it and why?
Hey, welcome back to the Mark Hallie Show. And today I have a couple women from the Snohomish County Human Services. And, I want to read their mission statement just because it's important, I think, to clarify. And it's the mission of the Human Services to help persons meet their basic needs and develop their potential by providing timely, effective human services and building community. As examples, elderly and disabled adults are worked with, drug and alcohol treatment, mental health counseling, 24-hour service crisis, services to help low-income households, and early childhood education programs for low-income families. That's just a few of them, and there's so many more. So with that in mind, I'd like to introduce Anji Jorstad and also Amy Wheat. And Anji, I'd like to start with, if I understand it correctly, you're a little bit more of the all services within the Human Services group, while you're more specific. Is that fair to say?
Sure. I supervise our behavioral health division within the Human Services department.
Okay.
So there's a lot that happens in our office.
Okay.
And so I oversee several different bodies of work that happen in behavioral health.
Okay. Why don't you clarify?
Sure. We have a team of about 20, and we have direct services. So we'll talk a little bit more about our scout team, our Snohomish County outreach team. We also have services that work in our county jail, in juvenile detention, really focusing on helping people connect to mental health and substance use disorder treatment. There are a lot of barriers in our system, and we help overcome those barriers and help support people on that path.
So are they coming to you, or I guess both? They're coming to you and you're going out to them?
Both, right?
Okay.
We try to connect with people in a number of different ways. Folks don't always know where to go or what number to call or how to start in the direction they think they want to go in. So a lot of our work is outreach.
Yeah.
Mm-hmm.
And would you say when you see people, a friend of mine told me he did sort of charitable work in Philadelphia, and he said you went out to try and help people on the street, but they wouldn't come. They would just walk away. They would have nothing to do with it. They felt like you were the big green government or whatever you want to call it. Are you running into the same problem?
There's a great story about our program. Many of our staff are embedded in law enforcement, and we started this work in 2015. And I'll never forget our first staff person came to me after 3 or 4 months, and she said, "Angie, you're not going to believe this. Up until now, we would pull up in a police car to an encampment and people would scatter. People would just run away. But today was the first time where people started walking towards us when we got there.
Really?
And so it is a process.
Sure.
People who are homeless, when they see a cop car pull up, they're not going to walk towards the cop car.
Run for the hills.
Typically, right? We've built a reputation over the last several years, and folks know which officers we're embedded with. We wear police vests, but they say social worker on them.
Sure.
We're recognizable. Our names are known now.
But within Everett, what would you say is the greatest time-consuming part of your job? Like if you say, is it homeless, or is it drugs? Is it childhood abuse? What would be kind of the first, if you got up in the morning and said, boom, this is what's going to be on the phone complaining or upset?
Today, I would say, the opioid epidemic has really negatively impacted our nation, but definitely Snohomish County and Everett. Untreated severe mental illness, coupled with the opioid epidemic,
they're part and parcel.
It's really difficult, and it's a really hard population to work with.
Yeah.
There are folks that aren't really interested in the services that are available, and our service system is it's broken and it's not easy to navigate. And
it's true across private, public, charitable organizations, just getting people aware of it.
Sure.
And now, Amy, you focus directly on opioid. You're a case manager, I think it is.
Yeah, my title is the Opioid Outreach Specialist for Snohomish County. Yeah.
Wow. So now, secondary to what Angie's doing, you're zeroed in.
I am. She's my boss.
Okay. Look at her. So, Amy, tell me just about a normal day for you.
There's a couple pieces to my job. I moved to the county from a treatment center as a counselor in 2017, and this was a new position. So coming
Local treatment center?
in Everett, Washington. I worked at Evergreen Recovery Centers.
Yep, I know it.
And I worked with the team, actually, the social workers who were embedded with the sheriff's department doing the assessments. So I got kind of connected with them. And then when this position came over, I moved over to the county. My day starting out coming from nonprofit work where you're running a million miles a minute, can't keep up with anything, creating this position, it was very different. So started out reaching out to fire departments, also embedded with law enforcement, going out into the field, working with individuals who've overdosed, trying to help them connect to services. So it's looked different over the years. Now a typical day is I manage a caseload. So I spend a lot of time in Snohomish County Jail. I mean, working in the jail.
Okay. Good clarify.
Yeah, good clarify.
Amy has an opioid addiction, so she can really communicate with the users. Actually, she steals the drugs from them. I'm here to help. Give me the crack right now.
You caught me. Yeah. So I work with individuals, help them go through the process of getting an assessment. And then after they get their assessment, getting to treatment, whatever their recommendation is. Our program is awesome because we go through the whole process with the individual. So we help them, follow them through their steps. We stay in contact when they're in treatment, and then we're able to help them get placed in clean and sober housing, which we're able to pay for 3 months in full. And then after the first 3 months, we pay half for another 3 months.
Okay, good.
Yeah. So then they can transition school, work, getting on Social Security, disability, whatever that looks like for each individual. Yeah.
Because I know that extended care is huge.
It's very important.
I know that I've done some work at Milam down in Kirkland.
Yeah.
I know them quite well and spoke there and all that kind of stuff. They plop out after 30 days, and you're looking across, a group of maybe 125 people.
Yeah.
And you can just tell by looking or hearing what they have to say is we're gonna plop this man or woman out, and it's pretty much dead meat. The number of people that could possibly recover in that environment, really, really hard.
We early on really determined it feels unethical, honestly, to take someone and to help them through the process, help them into treatment, to use our resources, to use the state resources to help that person if we're not setting them up for success, and to return someone back to homelessness after they've gone through treatment. It's not gonna there's no way that can be beneficial or successful, and it's not ethical.
How do people become? Well, it's kind of a two-edged sword here, but Amy, from your standpoint, why do they get on the street? Why do they? Okay, I mean, obviously, I know it's not just you're, this born a vagabond and just stay that way. How do they get there?
Well, there are a lot of different ways. The individuals that I typically work with, there's been a huge population of people that started with the opioid epidemic in the pill time, right? And people who are employed, injured on the job, given these prescriptions, overprescribed, and then all of a sudden now they're dependent, and it happens quickly, right? A lot of valid, this is not just individuals who say, oh, I'm just going to start using drugs. I mean, that happens, yes. And for the most part, it's people who've had a legitimate prescription to, start that process. A lot of trauma. People have gone through trauma, growing up, and different situations of how they get
dysfunction or kind of organized dysfunction, I guess, if it comes to prescriptions, sort of doctors just saying, hey, here, take 10 and you just kind of get out of my way and keep taking these.
Right. And they're non-addictive.
Yes, they
back
are.
then.
Yeah.
Right.
Oh, I know. I know.
Yeah.
Same with benzos, like Xanax. Oh, no, it's fine.
Yeah.
It's okay. Take 17 a day.
Right.
And that's
Yeah.
a nasty drug.
Absolutely. Yeah.
So now the person has mistakenly got on it, and now somehow they wander significantly astream from, I met, wealthy kids and all that. So now they're,
Oh, yeah.
where, it's kind of hard to ask. How would you help them if they were along that line? What would you do if I said to you, Amy, how can we, let's stop that person? Or, when is the jump point? I don't know if I'm making sense or
No, it
not.
makes sense. I think the best part about my job is starting a relationship with someone.
Yeah.
I've met people that are in a camp and they're not interested. I don't need to talk to you right now, but I'll take your card.
Yeah,
you know.
yeah.
And then
Give me your card.
yeah.
You're in a tent.
Right. Keep track of that.
Yeah.
But then it's continually showing up. We're going to come back, and then I come again, and maybe they're having a bad day.
Yeah.
And it's like, oh, well, what can you offer?
Yeah. It's like actually kind of like sales,
Yeah.
I said in sales, I'm like rust. I won't go.
Yeah.
I just slowly burrow in.
Yeah.
And Anji, from that perspective, where are you in all of this? How are you're seeing a broader range.
Sure.
So now all of a sudden you get called in, but what would be tell us a little bit about your game as opposed to when you engage with Amy.
Sure. I have the privilege to supervise amazing professionals that are doing this work every day, and I get to field their phone calls when Amy's calling me out in the field and she's up against a situation maybe she hasn't experienced before, or she's working with someone and maybe they have extreme medical issues, or maybe they're kind of on the fence, or maybe they have some things that we could potentially take care of for them to enable them to get into treatment. I get to work with every staff person.
How many case managers are there?
We have 9 social services professionals on this team.
Okay. And if we say your team within the organization, going through, I guess, homelessness, elderly, child abuse, et cetera, are there 100?
The Human Services Department has close to 300 employees and in all of those areas. So yes, working with older adults, working with people that are homeless, and not always doing direct service, but also contracting out dollars to our nonprofit partners to help them grow their
being
work
on famous shows.
And being on famous shows.
Yeah,
absolutely.
I mean, what
That's
the hell?
part of it too.
I mean, let me tell you what, if I didn't have you guys, no audience.
Well,
nothing.
Here we are.
I didn't want to say it.
I didn't find you. You found me.
We begged.
Right.
That's right.
Yeah. We begged.
I said, listen, girls, enough already.
Just bring them on. Make them stop.
Holy shit. When are they going to shut up?
Right.
So anyway, we had 300 in the office. How does somebody get like that? I guess there's some funneling, like somebody talks to somebody and it's kind of down to you.
In terms of people in the community who need services?
Well, let's say there's 300 people there and somebody has a problem. They have to funnel to you and then get to Amy.
Well,
or are they calling you directly?
It kind of works differently. Like our team, our outreach team, they're the ones out in the field getting people to ask for services to begin with. Like these aren't people that are reaching out. These are folks who are so deep in their addiction and are so isolated in their homelessness. They're not interested in doing anything different other than what they're doing. And so we're going into those encampments. We're going out to meet with them and saying, hey, is this working for you? Because if it's not, we'd love to help you explore a different path.
Yeah. Well, it's through AA, you sort of say the same thing and you go, okay, it seems to me like where we are now, you really got this stuff. You are a shit show. And maybe you would just let us give it a try. And people don't like that.
Right.
They don't.
Right. And we use different words than you're in a shit show. But
I would advise that.
Yeah.
In AA, we do.
And we all sort of gravitate towards what's comfortable for all of us. And that becomes comfortable for some folks. That becomes their community. That becomes, they know day in and day out, well, this is where I'm going to be, and I'm going to get my drugs, or I'm going to, try to survive, but I don't want to do anything different because it's hard. And maybe they've tried before, and maybe they've tried 20 times
Yeah,
before.
they're just defeated.
And they've been unsuccessful. And so they in that situation, we're able to come in and say, yeah, you've been unsuccessful, and we have a path, and we have connections, and we know the system, and we know the barriers, and we know how to overcome those barriers.
How do they get the money? I mean, here's this person lying on the street, begging for, $1, and now they have this enormous habit.
Unfortunately, it's very, very cheap to buy fentanyl. So the pills on the street in Snohomish County are selling for about $2 a pill right now.
$2 a pill.
I have clients that smoke 60 to 70 of them a day.
Holy shit.
So,
60 times 2, well, that's not much. It was $120 a day.
Mm-hmm.
So you can beg, borrow, and steal?
Yeah, I would say that's it. There is a lot of theft, and then selling,
All
offer
sorts of
up, and
things.
things like that happens. But there are people that ask, for money, which it's like, you give someone $1, buy them a burger.
Well, that it's interesting because there was a guy in Woodinville who would stand out on the corner and he would, blah, 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 blah. And I would say, I'll get you a hamburger. Or, no, I don't want it.
Mm.
Give me actually angry.
Yeah.
Like, what the hell, you're going to get a sandwich? Give me $1. I'm like, oh, well, I'm not giving you anything then.
Yeah.
And also, correct me if I'm wrong, I think there are people that will have a van and they'll put people in places. Have you ever seen that?
I don't know about the van, but I do know that there are people that strategically go to different areas that are affluent and go specifically, like I worked in Mukilteo, and there was someone who would go down at the QFC in front of Mukilteo after Boeing, their first shift gets
That's
off,
smart.
right? And it was a successful area for him, honestly. And that's why, I understand people want to help and try to do something.
Mm-hmm.
With that being said, the drugs are very cheap and people are dying every day.
$2 a pill. I mean, that's flabbergasting. These guys, this cartel group, they're smart.
Mm-hmm.
They know how to hit a price point. Like they say with potato chips, right? It doesn't matter how many potato chips are in there. It's going to be 99 cents. Done. That's what people can afford. So these cartels are smart. They've come to the conclusion at $2, I can sell a whole crap load of them. If I put it up to $5, I can't. So I guess they just keep cutting it to get the price down. Mm-hmm. I've always thought, wow, that's evil and really smart.
And I think too, and there's some great publications out about this. Now that the drugs of choice are synthetic, it's not about supply and demand anymore. You don't have to grow, a certain amount of poppies and to create a certain amount of heroin. It's all done in a lab. And so you can be very exact about how much of what you're putting into this product to get the profit that you're
and the impact.
And to if the amount's too high, you're going to kill a lot of people because they're going to overdose. So how do you fine tune that exactly so you're getting people addicted enough to keep wanting your supply?
Yeah, a dead person is not a buyer anymore.
Absolutely not.
Right.
So if we move upstream, I have a question.
Mm-hmm.
Do you think that the legalization of marijuana has, of course, a gateway or has increased the likelihood of somebody moving into drug addiction?
That's a good question. I honestly believe that the gateway is trauma.
Okay.
I think that whatever you start with can be the gateway. It could be alcohol. It could be, pot. Whatever it is. I do think that, street drugs change hands at least 10 times before they get to the person using them. So the benefit of having dispensaries is that you're getting a safe product because right now on the streets, fentanyl, marijuana can be laced with fentanyl. It's not likely, and it can happen. But if you go to the dispensary,
it's good stuff.
Yeah.
But in your world, 10 times it's being touched. Where would you? I'm just asking you because I would like to hear your opinion as to maybe it's your question. How far up that chain can you identify things?
When you
let's say, okay, I just bought it on the street and I got it from you, okay, and you got it from Amy, and Amy got it from Harry, like, can you chase it upstream? If you know what I mean, like find where they got it, go up, go up, go up.
Not typically.
No. And honestly, that's not our line of work. Like, we're really focused on, you're in front of me now and you're struggling. How do we connect with you and how do we help you? We are going to trust that there are other
people that are doing that.
People looking upstream and doing the work to try to curtail, that business.
Yeah, I had a good friend of mine who he was that. So he was going upstream and
That's
trying
what
to
our
find.
drug task force,
Yeah.
excuse me, is focused on. They're not, a lot of the clients I work with sell,
Yeah, of course.
but they're very low level, and so our Snohomish County Drug Task Force is focusing on the upper level.
But they are not specifically within, like, you don't have like I'm going to sit down with these folks once every 3 months and, I don't know, where'd you find these guys or gals for that matter? There isn't that.
No.
Okay,
No.
which makes sense. So you're in harm's way if you get into that crowd.
I would imagine.
Yeah. Well, you're in harm's way for yourself.
We are, like I said, we have part of our team is embedded with law enforcement. And so there are deputies or officers who go out with us and help secure the scene, help make sure that, we're not walking into a dangerous situation.
Yeah.
And honestly, I've been supervising this team for years. I think there have been twice where we've had staff that felt like they were in danger and felt like they shouldn't stay in the space. These are people who they're desperate and they're struggling and they're not there to hurt us. And so
they just want the drug.
They want the drug or they want help.
Yeah. Yeah. They just don't know how to do it, or they have no self-confidence, or they're just beat. They're just beat down.
Absolutely.
Yeah.
And I want to just touch on, I appreciate you bringing up trauma being the gateway. I think that is the common denominator.
Let me interrupt for a second.
Yeah.
You have been 31 years in the game.
Correct.
That's a lot of experience. And you've also been, how many years were you again?
I don't want to date myself.
Okay, let's start.
I'm just kidding.
Not
2012,
more than 4.
So 12, yeah. 12 years.
Okay,
Yeah.
12. So 31, 12, that's no small amount of experience. But so you have done non-charity work, government work, or pardon me, non-charity, charitable work and government work, and bounced around a good bit, well, not bounced around, but used it through different avenues. Do you feel as though, would you consider that the Snohomish government is better than a charitable, or does it have greater breadth?
That's a great question. There are pros and cons with both. I think that working in a nonprofit, I certainly had more flexibility, was really able to I think, be more nimble and create different opportunities within that nonprofit structure.
Yep.
Government, has it's kind
Very
of
rigid.
rigid. It's got its procedures and policies, but there are more resources available. And so we have resources working in a government entity that we wouldn't have working in a nonprofit.
Yeah.
We then also are able to help provide those resources to nonprofits. And I have that lens, so I sort of know how that works, and I know what they're struggling with and what their barriers are. We can use our resources to help shore them up.
It's very different in the way, I would agree with, in nonprofit, it was so busy. It was hard to keep up. You've got all these clients, you're running groups, you're doing assessments. It's just constant.
But is rehab nonprofit?
Well, the one I worked at.
Okay, so
Evergreen
you're
Recovery.
in there. Okay, Evergreen Recovery.
Yeah.
Okay.
And I was the in-jail treatment counselor. So I would go into the jail 4 days a week and take the intensive outpatient treatment into the jail for the female population. So that was a little different. I would
in IOP, again, what is it for those who may not know?
Intensive outpatient treatment.
But if they're in jail, how do they have out? How's it out? Because they're locked in bars, I think.
So we would go into a classroom in the jail, and then they would come and we would have 2 hours a day. And rather than, if they were out in the free world, so to speak, they would show up at Evergreen, come to group,
Yep, I know that well.
Yeah. So I would take it in, and then we would run that group, have that group in while they're in custody. And I think that's really was my heart was that population and really getting to know those women and understanding what they'd gone through to where they were, sitting there in that jail. Um, and so now it's like the best of both worlds because I get to go out with the cops and I get to go into the jail.
You get to rock and roll with the cops?
I sure do.
Wow. My daughters say the cops are good looking. They're always saying, no, that cop's, it's firemen.
Oh, yeah.
Firemen.
The real heroes.
Yeah, the real heroes.
Yeah. That's what we joke with our deputies. We're somewhere at a coffee shop and they're like, oh, the real heroes are here. I'm like, they sure are.
We were looking at something to get a environmental, whatever it was, in a new office. And 2 firemen came in. And this young lady who worked for me, she steps in and says, I'll go up with them. And then when she's going in, she's like, oh, no. But anyway, enough with those joking around.
Yes.
So back to where we were.
So I think that being in the role that I'm in now, again, is there are more resources, being able to, I'll meet with a client. We'll meet at Starbucks to start. I'm not ever going to tell my clients what to do. I'm going to strongly encourage because I have some ideas of what would be helpful.
Yeah, but you can't talk somebody into this stuff.
No, absolutely not. And I think the second part of my job, which we haven't talked about yet, is providing education to the community about what opioid addiction is. There is a huge stigma surrounding opioid use disorder.
Of course.
And I think it's due to lack of education.
Sure.
People don't understand it. And they have this assumption that it's just the individuals that we work with, driving down the street.
Well, they're just cast aside. They're castaways.
Right.
If something happens, throw you out the door.
Right.
And now, off this subject of touch, you're also dealing with homelessness. And are you dealing with anything regarding like child abuse? Does that fall into your world?
That's not something that we touch very often. Every once in a while, we'll see folks who are underage or someone with a young child, or maybe someone who is pregnant, who is struggling with addiction and homelessness, and we help connect them to the services that are available to help support them. It's rare, though, honestly.
Mm-hmm.
Okay. So for you, you're saying it's the underlying, which is obviously true. I think, well, not obviously. We'll talk about it because it's not obvious. It's the underlying abuses and or whatever that may be that creates this personality profile that wanders into drugs.
Well, and what we know about trauma is it changes your brain. It changes the chemicals in your brain. It changes what you're able to, how your receptors work. Traumatic experiences do that.
Oh, yeah.
And then someone stumbles upon, a prescription for Oxy after they get their wisdom teeth taken out. And what many people will say is they take that drug for the first time, and it's the first time they felt normal. Mm-hmm. It's the first time they felt okay. So if you think about feeling okay and feeling normal, we want more of that, right? We want to feel okay. We want to feel content. And if that's the first time somebody feels that way, they're going to want more of that. They're going to seek that out.
It's like me with a Diet Coke. I converted from drugs and alcohol. Now I'm truly addicted to Diet Coke. I go to the store and I feel comfort. I feel like, the world's good.
Yeah.
Mm-hmm. I love it.
Yep.
My wife doesn't. My daughters don't. But the hell with them. I'm addicted.
It means more for you.
Yeah, exactly. Yeah. And they've dropped the price just like the cartel. They've got it down to like 99 cents a hit. I'm like, yes. I can buy one for you if you want. I really would. I'm a wealthy man. I can grab one for you. So now over to you. You talk about we in recovery. You say it's not the alcohol, it's the ism, and that's so very true. What would be the most common form of like a trauma? Would you say, oh, it's boom?
I would say a lot of, and all I can speak to is the people that I've worked with.
Okay.
And a lot of what I hear is family growing up, neglect, potentially abuse, but growing up in an environment that they're not supported or felt loved.
Okay.
And I mean, that's not for everyone, but
there's just a vacancy. There's just a
Yeah.
sense of I'm just a little kid stumbling along.
Yeah. I think bullying can play a huge role.
Yeah.
Feeling that they don't fit in and kind of like what you said, and then you feel that normal by using a substance or kind of in this crowd that kind of starts, oh, let's try this. And, I don't know. It's a hard one to answer.
I think it's rooted in attachment. And I think you talked about your friend who goes into the NICU and holds babies. Those babies are crying, and what they need is attachment, right? What we all need from the very beginning is to feel attached and nurtured and loved. And so there are many things that can sever that attachment. That to me is the root of where that trauma starts. It could be abuse, it could be neglect, it could be the absence of parents, it could be parents who are struggling with their own issues and just aren't there to really nurture their child. When we don't have the ability to attach to people that care for us, it causes problems.
You only meet them when they've hit crisis.
And it looks different for everyone because some people have been on the streets for years and some it's fairly new, but for the most part, they're in a position that they typically, they don't want to be out there. They don't, for the most part. I mean, they may say, no, I'm not interested in services right now, but that's because they don't quite know what that looks like. It's out of their comfort, right?
Yeah, you're frightened. Everybody, I mean, you haven't had anybody help you. So you're just like, here comes another person who scares me.
Yeah. And if they try to do it on their own, the system is extremely overwhelming. I get annoyed at the system and it's my job,
Who wouldn't?
Yeah. So if I'm someone who is living in a tent, I want to get clean, but I know I'm going to go through the worst withdrawal from fentanyl.
Well, of course.
It's going to be horrible. I'm scared of that. I don't know what I'm going to do next. I have no support. How do I even start? So that's where our team will come in and say, let me walk alongside you.
But you gotta find them.
And we do. They're plentiful.
That's not the hard part.
No, I'm sure. Yeah, I know.
Yeah. But being able to be that support and help, and then them start to realize, wow, this person keeps showing up for me, and they are doing what they said they're going to do. We take pride in that, and going through that whole process.
Well, and I think somebody who's had the skill, it's like psychologists. Somebody once asked me, should you go see a psychologist? Why? That, and somebody said to me, why not? Like flip the question.
Yeah.
Say, oh, because I can handle it. Wait a minute. Why not? Why wouldn't you? If most people, let's say, who are employed, have some form of a health program, about like $20 a week, maybe 40, 50, I don't know. Why wouldn't you? I don't get that. Well, why wouldn't you? Because you don't know where the hell to go.
Totally. Yeah. Where do you even start?
And I think there's still stigma in our society around asking for help, right? I think we live in an individualistic society where the goal is, I'm going to do it myself. I'm going to figure it out. I'm going to be successful, and we shouldn't need help. Well, that's not
realistic.
Accurate. It's not realistic.
Have you ever seen the narcissism scores? If you go back to if you ever read it, they do these polls on people as to what are they narcissistical, not all the way, but I mean, are they tending that way? And that, in the 40s and 50s, what do you want to be? I want to be a policeman. I want to be a fireman. I want to be this, that, and the other thing. Now, it's just slowly migrated to, even you look at the commercials, you're going to do it. Nike, any of these ones, you're going to be this, you're going to be that. You ask kids now, what do they want to be? It's Taylor Swift. It's something that's just them. And I think if you ever get a chance, and if you ever get a chance to look at that, it really was compelling, because I think I was born 60, I was there, by the time I hit 12, it was pretty clear, well, of course you had all the Vietnam and all those guys are jerks, and so slowly you're migrating away. So back to our discussion is, you're getting into this narcissism, and I guess the parents must be narcissistical to get the kid narcissistical, and then the kid gets into this stuff. Where am I getting here? I don't know where the hell I'm getting here.
I think as a society, we're
Let me give you a map.
Hold on, right, left. I'm lost again. I'm trying to make a damn conversation here.
You're doing a great job.
Yeah, I know. Except there, I kind of fumbled on that one. But let's get back to let's get back to people who need help. And so you find a dysfunction within an individual. You say, geez, are you then promoting? Do you have a psychologist or psychiatrist on staff?
We don't. And honestly, the reasons that brought them to where they are aren't as important to us as how to help them move in a different direction. We know that there's trauma anecdotally, but not because we do any formal mental health assessment. People tell our stories. They start to trust us, and they start to share with us sort of what their path has been. But our focus is really forward.
But you are not psychologists.
No.
So that puts you into a little bit of a, I mean, I guess at some point or another you see somebody and you go, oof, this is past my pay grade. Are there anybody out there who's like pro bono psychiatrists? Or, people say, yeah, I do it for free.
No. And that's one of the many barriers to people getting access to mental health treatment. Most of 95% of the people we work with are on state health insurance, Apple Health, Medicaid. Even in those circles, there aren't enough providers that will bill Medicaid that can see the folks that we need to see.
Yeah. And the Medicaid, if they do get it, it doesn't comp them to the level they want.
No.
They charge $100 and they get $25.
Right. We have treatment agencies that are closing, that are laying people off, that don't have enough people just to do an initial assessment because they can't afford to keep the doors open because Medicaid reimbursements are.
And the government doesn't offer any of it. Is there like another psychiatry department or not until, I know a guy who was in, I thought he was in some government prison where he just gave I guess he just gave out meds. But that would not be part of you guys. You just wait. I guess they wait till they get to prison.
We help people connect to services where they could get on medication. We have, Snohomish County has a great program that just opened a few years ago. It's a urgent care like you would go to if you, broke an arm or but it's a psychiatric urgent care,
cool.
A behavioral health urgent care. And so someone is urgently needing a mental health assessment or medications for mental health or a substance use disorder assessment. They can walk in. It's not open 24/7 yet. It's run through Providence, but it is a new way of looking at the need for urgent behavioral health care services. They take all or no funding. They're funded differently. So
we utilize them.
Yeah, that utilize. But once again, you can't force somebody.
No.
If they're an adult, they have the freedom to just say no.
Yep, they do. Yeah. And that's why the relationship building is so important.
Yeah.
Because, let's start here. This is what we're going to do first. Okay, and then that gets accomplished. Okay, well, let's meet now and let's do this next step. And then if someone maybe has been on mental health medications in the past, they know what worked, what didn't. Now they're struggling in addiction. Okay, well, let's get you over to Providence Behavioral Health Urgent Care. Let's get you back on your meds. Now that you're through detox and moving forward, we can start, building those bridges.
Plus, we got your head cleaned up. We can actually tell,
right.
You are, manic, or you are, some of them are wildly off the charts.
Absolutely.
My daughter was down in the apartment complex in Seattle, and she had this gal, I can't remember, first floor, second floor, right near us. And of course, she'd go nuts and start, freaking out. Causing, clearly mentally, seriously ill. Well, she's a squatter. So she's in there and, in a tent in there. So things are really screwed up. And one night she chucks everything out the window. So now we got a police situation going on. Cops come and they're going to swoop up her and they're going to take the dog. And my girls are, my God, they'll save a worm. So... I'm giving money to that damn aquarium. I'm like, oh my God, really? We got to save all the fish? In Philly, there's a lot of really polluted stuff, and we don't want to. Those fish should die. But anyway, back to so the dog is taken and comes to our home. But I guess that's sort of the ancillary things. Like all of a sudden now, this woman, when she comes out, she very well need that dog.
Oh yeah.
As a counselor, or a comfort zone. So my wife is saying, well, we have to let the dog back. But in a way, you're saying, oh no, this little dog's going to go into this crap situation. But when you get into these psychiatric things, you can't assess. You can just say this person's acting really wacky.
We have a team of licensed professionals. So we have licensed mental health counselors, social workers, substance use disorder providers. So we have education and experience that allows us to have a really good sense of what someone is probably struggling with. But assessing and diagnosing isn't part of what we do.
Let me compliment the services from King County, and I'm sure from Snohomish. We had a thing in our family where things were going wacky, and we got, there was a police involvement, and then the case where I don't know who it was. The woman who came out to work with us was fantastic. She must have spent 3 hours with us. She was our only point of contact when we were freaking out. And, that was just really cool because a lot of people have the sense of, oh, the government's coming in and what the hell's going to happen.
Yeah.
This girl was lock and load. Anytime you want, here it is, boom, 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 boom. And, so I want to pass that along, and I'm sure that you guys do the same.
It's the goal.
Yeah.
Yeah.
And I'm sure they aren't all there. I imagine some of them are whatever.
Yeah.
Like any place.
I don't know. I think we have an amazing group, amazing team that are dedicated, that are professional. I think that go above and beyond every day. So I feel really fortunate.
Okay, I have a question for you.
Mm-hmm.
If you had to guess,
I'm not answering.
You have
I
to.
take the fifth.
No, I want you to say that was a good question.
Good.
Okay.
Wow, that was a good question. You haven't even asked it yet. Wow.
I'm waiting. Yeah. Okay. Be ready. So I'm going to ask for, if you had to guess in 2022, what percentage of opioid overdoses occurred in Snohomish County? What percentage would you guess were also homeless? So opioid overdose and homeless, what percentage?
Oh, I've got to think. Opioid overdose. Okay. So we got a guy hanging out and he overdoses.
Mm-hmm.
Was he on the street?
Yeah.
Or was he not on the street?
Yeah.
It's a trick question. But I'm going to go with significantly the person on the street.
Yes. And that is the idea of what this is. In 2022, 57% of opioid overdoses in our county occurred in private residence.
Wait. So 57%
Yeah.
are private residents.
Yes.
Wow.
Blew me away. I mean, when I was asked that question, I was like 100% because that's my caseload.
Yeah.
No, this is happening across the board. And we have this idea that it's only affecting the people we see on the news, the people we drive by on the streets, right? That is not the case.
More than half
Yes. Yeah.
are dying in a home.
Mm-hmm. Yeah.
Holy shit.
Yeah. It's scary.
Yeah.
It's scary. And a lot of times when it's an adolescent, there's someone else in the home. You know what I mean? Like they don't.
Yeah, they don't know it.
Right. Yeah.
And then is he even reported? I would
Right.
imagine, your son dies and somehow or another you're not letting anybody know that it's an opiate problem.
Oh, because there's a stigma.
Right.
Because there's judgment
time.
and shame and everything that goes with that. And that's why people don't reach out. That's another reason why.
Yeah.
So
Another part of Amy's job, which you haven't tooted your own horn enough, I think, is in this community education. Part of it is about talking to families about how to keep your home safe. This notion that, that it doesn't happen in families, it does. And so how do we help families understand how opioid addiction works? How do we help give them the tools to keep their family safe and their loved ones safe? So we talk a lot about naloxone or Narcan, having that in every household, in everybody's purse, and lock bags to make sure your medications are kept safely. It's little things that we can do to help save lives.
Because that was the thing when my kids were young, junior high, moving towards senior high, where there's this whole underground communication of like, JoJo's dad's got cancer and it's ripping, so now they're snitching it off the grandfather, whoever it is. And I guess that's the early stages of it. That's back when it was so readily available. Mm-hmm. Oh, did you hear about this thing about McKinsey? They're getting a $650 million settlement. Just today it came out where they were McKinsey. Let me correct myself. I believe they are a consultant. Correct me. I may be wrong here, but there's a drug manufacturer and they basically sort of ignored this problem. So they just got popped for $650 million.
wow.
So, it doesn't surprise me that the pharmaceutical companies are smart and the guys and gals come in and they say, they just look over it, whisk over it, and everybody just doesn't bother to ask. I guess somewhere within it was a government case and they snagged them. Where the hell were we? I'm at a loss. Oh, you were complimenting Amy.
Oh, you were talking about how good I do.
I was
job.
talking about how great Amy is, but we were talking about just the community education and how important it is because this isn't a homeless problem. This is an everybody problem.
So, are you going into the schools? Does your organization go into the schools? Is that part of what you do, or is there another group?
We have programs in our office that work with youth in the schools, and then we also we provide education to schools also about.
Fun fact. Back in February, Senate Bill 5804 passed.
Fun fact.
Fun fact. And that was in Washington State. It was requiring every school to have Narcan on site. Prior to this bill, it was only schools that had districts of more than 2,000 students.
Really?
Yeah. So I had the privilege of training all the schools in Snohomish County. We would train the nurses, and then sometimes, actually, a shout out to Darrington up north. They had their initial training with the nurses, and their principal required everybody on their staff when they came back at the beginning of the year to come and have the training. So my training includes opioid education, Narcan, deployment, and then also prevention. So she made it part of their return to work where they had to take this, hour-long training.
And then there's Narcan on site.
On site. And then people, another cool thing is that we're able to provide Narcan to people that come to a training, additionally, for personal use. So getting it out there and getting it out available. I know so well in my job, I can't force someone to do something. I can't force them to stop using.
Yeah.
And if they have an overdose and they lose their life, there's no even opportunity for them to try to do something different, right?
To say the least.
Yeah. So, people can say what they want about Narcan and that it's, just creating this enabling, someone to keep using. Bottom line is, what if that was your kid?
Well, they're not dead.
Exactly.
I mean, you got a chance for it if they're not dead. They go back out and use it again. Okay, we'll give it to them again.
Right. Exactly.
Let's hope they eventually catch on. Have either of you had any attempted physical harm done to you or anything that was in a frightening setting?
I've only had one instance where I was with the deputies and there were multiple officers there, and it was a woman who was experiencing a mental health crisis.
Okay.
And for some reason she fixated on me as the enemy. And so I was kind of standing back, and she did run at me. My partner, who was big, tall guy, he stuck his arm out and got her. That was the only time that I was like, oh gosh, I'm not sure how I would have handled that.
Yeah. You were mentioning, Darrington and well, there's a whole, and this might support the 57% that are dying in their home, is, clearly those areas are becoming more wealthy. So the more, what I mean, there's more nicer homes, more greater expansion of who's there, maybe expansion of the demographics. So maybe, I don't know if that has some, you know what I mean? Now you got more, middle to upper middle class people in your area, which may move. You understand what I'm saying?
Yeah.
Maybe just more people in that demographic. So
Yeah.
more people who we would not think are going to be in that problem.
Yeah.
So all of a
Well, and
sudden,
using pills is different than, it doesn't seem as dangerous. So especially with the youth, they think, well, I could take this pill. What's a pill going to do? Right? It's not like putting a needle in your arm.
But some of them are shoving needles in their arm pretty consistently.
It's
Are they
usually not-
smoking it?
It's usually not where they start, though.
Oh, no,
Right.
I wouldn't think
Right?
so.
Yeah.
you
Yeah.
know?
Yeah.
That's
Yeah.
like the Mendoza line for a lot of people. Anybody know what the Mendoza line is? There's a baseball player who, it basically, if you hit under 200 in the pros, you're under the Mendoza line. So we get rid of you.
Mendoza must not have been a very good baseball
He
hitter.
sucked. He sucked. So the people, shooting needles is kind of like the Mendoza line. You cross
Yeah.
over that, and it's like, oh boy, now you're in the bigs. So is there a lot of within? Okay, let me go to Snohomish, the town of Snohomish. It's an adorable little town. Anybody that's go to Snohomish.
Yeah.
You don't see homeless in the Snohomish little city.
What's interesting in Snohomish County is every city is different, and every city addresses their issues differently. And so we have some cities who have embedded social workers and some that don't, and some cities who take more of a strict enforcement role around visible homelessness, and some who don't. And so yeah, I think Snohomish does look a little bit different than Monroe or Lake Stevens or Arlington. It really depends on the municipality and how they decide to address and work with and support folks that
In a
are
little town
struggling.
like that, you think that's where the rich people are. So if you're a panhandler, get the hell down there. But obviously, there's some form of,
Oh, there is. There's some people
somebody's
experiencing
whisking
homelessness,
it.
and
But I mean, when they get into that little town, there must be some way if they're just keeping them away for the good of the overall economy.
I don't know. People that are homeless also are they're aware of where they can be and not be disturbed and not be bothered.
Okay.
Every town has people that are homeless.
Okay. Let's circle to your personal lives.
Oh.
I know you both have children.
Mhm.
Okay. Do you like your kids?
I love my kids.
And you?
I love them.
Because I thought on your intake form, one of you said you didn't.
No.
Wrong show.
Yeah. My sister said, biggest problem with kids is you love them too much. And I think that's so true. So it's hard to separate these two things. You got a pretty intense emotional game. So what are your strategies to do that?
To separate work and home.
Yeah. What do you do? That's a good question.
Yeah.
I'm not saying it anymore.
Well, you must have something where you kind of have to just turn it off, or at least push it back.
I have a great support system that I'm able to sort of vent with and talk with and express my frustrations with. And I think it's really leaning on other people, not feeling like you can just do it all yourself.
Yeah.
To help carry that burden and to help process the things that we need to process so that we can walk through the door. And, maybe I bring some things home with me and I talk to my husband. We kind of talk it through. I have a 20-year-old, and so he's able to have some of those conversations.
Why do you like
too.
the 20-year-old?
Oh, he's adorable and he's lovely and he's smart and fun, and I like hanging out with him.
And is the next one a boy or a girl?
Also a boy.
And you like him?
Also smart and funny and cute and
God.
fun to hang out with.
Wow,
Yeah,
wow.
I'm very lucky.
And you're objective.
I'm very objective. Absolutely.
I would agree with her statements.
And Amy, how about your children? Do you like them first?
I love them.
Okay.
Yes.
Same answer.
Yep, I know. Yeah, my daughter is actually a junior down at Arizona State University.
Cool.
Yep.
Nice.
I love to go visit.
Absolutely.
Look forward to Mom's Weekend.
Yeah.
And she is majoring in special ed,
Cool.
which is great. My son, he's living with me right now. He graduated from UW last year.
A lot of kids are doing that now.
Yeah. He's working on his master's and substituting in the Lake Stevens School District.
Good for him.
Yeah,
Good for him.
His girlfriend just got accepted to medical school, so they will be
keep her.
moving.
Keep her.
Oh, he's planning on it.
Oh,
Yeah,
baby.
Yeah, yeah.
I just tell my daughters, just fish for a rich guy. Throw the emotion out. In
Yeah.
today's world, you get rich, you get in on half the cash, and you ditch them. Listen, the world's a tough place.
If I didn't learn
It
anything
is.
from the show, I learned that. So I'll take that with
And
me.
maybe the two of you, trade up, girls, trade up. But anyway, and then, so I know that you've had, those challenges, which are inevitable. And then you're an elected official.
I am.
Wow.
Yeah.
And tell our crowd what that is.
Yeah. So I am a.
Does anybody vote, or is it just like one person votes?
I voted. I voted yes.
We have about a 35 or 40% voting rate in Lake Stevens. So I'm a city councilwoman for the city of Lake Stevens.
And does that get a little, I know in Little Woodinville, it can get pretty, mudslinging.
It's 7 people who have really different values and really come from different places. And so we have some pretty intense conversations.
Yeah.
I think we're all committed to wanting Lake Stevens to be the best city
But
it
you have
can
to go out
be.
and get votes. And there may be somebody who's challenging you for that position.
Yeah, campaigning is not my favorite. I don't like it.
But
So-
there, imagine you get sometimes some mud slung at you.
This last round, I ran.
Don't tell us why.
I ran unopposed.
Unopposed.
So
Thank
that
God.
that was really a different experience.
That payoff was worth it.
Right?
So do you just criticize in general if there was somebody running with me, against me?
It can get mudslingy, but
Political.
it's political. Politics are weird,
Yeah. Oh.
and that's not my favorite part of it. There's work to be done, and I think I like doing the work. I like learning
Yeah,
about.
I was approached by somebody to be involved in the Woodinville, and I just said no.
Mhm.
I've
It's not
got
for
kids
everyone.
here. I'm just not gonna. I'm not going to have somebody start slinging mud at my girls. And I felt as though I could provide a service outside of that, and I think I did. But the political world and I think it's hard to get anybody in that now,
I think so too.
I would think in your life, how many people do you know that ultimately got into political life?
Well, I know a lot now.
Well, okay, because you're in it. Oh, great.
I know. I'm looking at the one that I know.
Yeah. And there's a problem.
Yeah.
See,
Right,
they
yeah.
drag in anything. So
Without lip gloss.
Right. I know. I grew up in a really small town in Oregon, and my mom was on the city council. And
Okay.
I think had that not happened, I don't know that I ever would have even considered that, but I got to see it from a different perspective, and I got to see the work that she did. And it seemed like, I love the town that I live in, and I love the opportunity to try to make it better.
Okay.
And you're a change maker.
Oh,
Is that a word? Yeah.
it is
I don't
now.
know.
It is now. But yeah.
like
No, but
Change
you.
maker, water controller, whatever the hell it is, You can make people better. It's like,
Yeah.
I know, honestly, do you know anybody if you kind of scan the horizon, somebody that went into it?
Not outside of Anji, honestly.
Yeah, yeah.
Hmm.
Because I don't either. And I ask my friends, so then I start thinking, well, where are they coming from?
Mm-hmm.
Because they do seem, whatever side you're on, a sense of detachment.
I think
who is that?
I think the higher up you go to, I see that. I'll just speak for myself. I think that at the city level, you get to talk to the people whose decisions you're impacting and you're affecting. I think as you make decisions at maybe a county or a state level, you are more detached because there's so many more people, and it's harder to stay connected to the decisions that are impacting those
and all
folks.
politics is local, they say, ultimately. So anyway, but they get to that certain point where they start looking like a politician, like the clean chiclets,
I'm not there yet.
and the same, you know what I mean? Like you look at them and go, wait a minute, there's something weird about that guy. I wouldn't hang out with him. But anyway, so we have to close up. Okay, we're going to circle around to the final question.
Okay.
And, at a deeper level, why are you doing this, Anji?
I think I knew really early on that I'm a helper. I believe in the notion that if I help one person, then I've done good work. So I gravitated towards this field because of that. Now I get to supervise amazing people doing great work every day, and it's hard and it's heartbreaking. And every day there's one person that we've made a difference in their lives, and that's worth it.
And it's safe to say that your mother influenced you because of that, her commitment to a small town and the city.
Sure. I think I've had the privilege of having, a great family and influencers, my mother, my grandparents, watching that, watching people impact other people, has been a great part of my
And you,
life.
Amy?
I honestly went through my own event back in 2009 where I went through a divorce that I wasn't expecting.
Yeah.
And I had stayed home with my kids for quite a while. And then I thought, well, I have to go back to work, which is fine. I don't mind working.
Yeah.
And if I have to go to work every day, I'm not going to go just get a job that I'm clocking in and clocking out. If I'm going to be away from my kids, I'm going to do something I'm passionate about and that I love. So I looked around, tried to figure out what I wanted to do, and then came across the program up at Skagit Valley College that was a substance use disorder professional program. And there have been individuals in my life that I've known that have struggled with substance use disorder.
Yeah.
I grew up wanting to be a police officer.
Okay.
So I went back to school, and it was tough. I mean, it was, I had my 2 young kids and had so much support from my family. And, but I got into this same thing. I like to help people. I wanted to make a difference. I want to make the world a better place. I just do. And we all
what drove that? What I mean, underneath?
I don't know. Well, I mean, I don't know. My dad is a big influence in my life, and he's the kind of person that's just kind of how he modeled life,
Okay.
And so I always wanted I wanted people to feel love that don't experience feeling love, like
That's a
that's
fair
how
point.
I felt growing up. I felt really blessed and lucky to be in the family I was in. And it breaks my heart to think that there are people that don't have, good things in life.
No,
So
there's no wrong answer there.
yeah.
Mhm.
So yeah.
With that, I just want to say thanks so much for coming in.
Yeah.
Thanks
for having
the
us.
opportunity.
You're welcome.
Thank you for listening to The Mark Halley Show. If you found this story as intriguing as we did, give us a like, share the episode, and subscribe at The Mark Howley Show. New episodes every other Friday. Adios.